Hi everybody, happy Friday evening almost. I'm gonna give it just a minute to make sure that we are good and connected. Yes, it looks like we are. So, hi everyone, I hope you had a wonderful week. I am so sorry for the random late live today, but I thought late was better than never. We had a lot of surprises in the clinic today, a very busy day, but I do need to give a big thank you out to my entire staff for kind of doing a little surprise for me today, and that is truly why I'm late coming here to you, but for all such a wonderful reason and a huge blessing to be surrounded by all of these women who love and care for me. And man, it is just warm in my heart today in the middle of this wintry weather to feel so loved and blessed to have such wonderful people around me every single day to help us do what we love to do here and take care of our patients. And so moreover, I am obviously worn out from all the fun because I didn't even cry just now, right? Woohoo! Like I'm getting somewhere with that. Anyway, so again, thank you to my staff today for my little surprise or big surprise. You guys are truly the best and a huge part of what makes everything around here so good. And I love you all, just adore each and every one of you from the bottom of my heart. So that said, I thought I would do a very quick for you since it is the evening and I need to run, but something that has kind of been on my heart this week and kind of more so obviously now than ever. And so I think we hit the new year and it's been wonderful. And for a lot of us, we're really trying to focus on, a new year, new you. And probably it's just more challenging than ever. But we have more patients than ever coming in, trying to work through situations in their life related to stress, anxiety, regarding obviously all of the challenges in the world today. And more than ever, I'm getting questions from patients about possibly the need for some type of psychiatric medication and their concerns for that and worries for that. And then also a lot of moms and dads with the same concerns for their kiddos, rightly so. And so I wanted to share with you one thing that we do have here that I think has become really integral to making that decision a little bit easier and kind of, again, just goes in line with everything about how we believe if you understand your body and to know yourself is to know your health. And so we as human beings, knowledge is power, and if you can understand how you are made, then you can better support your body and kind of support your overall health to be the best that it is built to be. And otherwise, you can kind of go in circles. So, historically, it's not super fun to be a patient or a doctor, I would say, and have the what medicine do we use for your anxiety, depression, acute stress, things like that, right? And a lot of patients have anxiety about the idea to take a medicine. So it's like the treatment for the anxiety is almost more anxiety provoking than the onset and the cause. And so that is often a cycle that we see our patients in, and rightly so, and we validate that for them. But one really cool thing that we do here to clear the mud as much as we can is, of course, our nutrigenomic testing. And one very cool panel of our testing is our DNA mind test, which I have right here, which I have found myself and with the patients wanting that information more and more. And so this is kind of an example of our little report. And so this has become very helpful, especially lately, maybe more than ever, in teasing through with patients what are their options, how can we know more about how their brain is made and what their thresholds are for the kind of managing through situations. Of course, there's life and there's all these external things, but it's kind of very helpful to know, okay, this is how my brain is made. Let me embrace that. And then what are things that could help my brain to work better, considering what I know about it? And oftentimes, again, like a lot of things that we talk about here, there is certain diets, vitamins, supplements, and things like that that you can use to support the areas of your brain that even genetically maybe don't work as good as the next person. On top of that, the other question I often get is, Dr. Stepansky, I've been on Lexapro for 15 years. Can I get off of it? I really hate that I need to take a medicine every day, but I do admit that it seems to have worked for me for a really long time. This test is also very helpful in that situation, because if we do the test and genetically you don't make really good levels of serotonin, then that supports the fact that, hey, Lexapro, it probably helps you, and that's why you get such a good benefit from it. And don't bang yourself up about it. Maybe it's really doing you a good, and in some instance that is such a blessing in and of itself, because a lot of patients don't get great benefits from those medicines, and in turn have a side effect issue even if they are getting benefits. So I've found myself ordering this test a little bit more lately. I'm sure it has to do with everything going on in the world today, but it's very helpful. And so it's literally looking at your genetics, your DNA of how your brain functions with regard to levels of serotonin, dopamine, norepinephrine, cell signaling, so neuronal firing of the brain, stress response, certain genetic variations we know are related to that, and even neurodegenerative disorders and things like that. So it's very helpful, inflammation of the brain even. So what we often do is we'll do that test, and then we'll get a report that looks somewhat like this. And then we put it all together. So we kind of look at that, and for example, this patient I'm looking at has a little bit of inflammation, has a slight genetic variation on their methylation, but a lot of dopaminergic issues and a little bit of serotonin. So on the one hand, if they were on certain medications, then we could support why it is or is not helping them. And on the other hand, if they felt like it was helping them, there's some things that we could absolutely do based on that information to make the medicines work even better, and maybe have less of a side effect profile, versus number 3 is not to have to use medicines at all and be able to support the deficiencies that naturally are there, with all the ways we know to increase and boost, for example, dopamine in and of itself for this patient. So this has been really a fun way to further explore, options for patients, instead of, or in lieu of, literally saying, okay, let's check the boxes, you qualify for this, here's the medication, call me in 4 weeks and tell me if you think it's working. We just haven't really done well in that realm. And it's great if it does, but I think that, we can certainly do better. And this is one way here where we have found, obviously, digging a little deeper and doing more customized, individualized diagnostic care, we can really more fully and completely look at anything and everything that could possibly help your mind. And so that is our DNA mind test. Obviously, it's hard for me to give one of those away this week because you may or may not want that. But what I'd love to do to kind of support, again, last week we did our foundation, our back to the basics, and that was truly with supplements and nutrition. And so this week I thought we would do, with regard to that, one step further and kind of support your overall mental health. And I would say knowing yourself absolutely helps to support your mental health. And this is all good and fun stuff. It's nothing scary. It's stuff that we can work with. And so it's absolutely one way to stay 1 foot in front of those things and or combat things in another way. And so that's what we are here to do with you. So for the rest of January, I would love to offer this test at 20% off for anybody who would like to do it. It is very simple to do. You can actually just show up at the clinic and the girls just take a little swab of your buccal mucosa in there and we send it off. It's super simple. A lot of our patients have already done it. If you've done any of our other tests, you know that these add-ons are very cost effective and easy to do too. So call in if you would like that. But we just think more information is wonderful. And again, it's not necessarily always to change what you're doing, but it's more information to support what you're doing maybe and help you feel good about the decisions you make, about what you put into your body, and what you choose to do with how you want to treat what's going on, which we always say there are 5 right ways to do everything for you. It's all about kind of partnering with our patients and discovering and continuing to explore options that could possibly help them live their best life. So we are here to do that with you. I hope you guys had a wonderful week. I had a ton going on. Today was kind of culmination of a lot of meetings I had to have. certainly some things that I had to wade through the muddy waters. But I tell you what, it was nice to come out on the other side of those things and have such a wonderful staff here to lift my spirits up and absolutely make me feel so loved. So here it comes. I'm not going to do my ugly tears, but I am very thankful today for all of them. They certainly improve my mental health every day to be around these wonderful girls. And I just love them and love you so much. So thankful for being here and being able to help you every single day. So we plan on doing that, and we will see you guys again next week. I promise it will be way better. We will do a ton more education. We were just had a lot going on today over here. So happy Friday, happy weekend, everyone. Hope that you enjoy your beautiful weekend. I know that I have some wonderful special plans that I am very much looking forward to. And so I can't wait for that. And I hope that you are going to do something special for yourself as well. So we will meet again next week. Love all you guys. If you're interested in doing our DNA Mind, please come by for the rest of January, and that will be 20% off in hopes to support you and your overall mental health. All right, love you guys. Bye.